Senator Masto, thank you for your time, and we appreciate the opportunity to present the Connect for Health Act to you. I'm Brian Thompson, and my colleagues are Deanna Penny and Jasmine Giles. Again, we're talking about the Connect for Health Act, connecting Nevadans through telehealth coverage.
Hello, my name is Jasmine. I just wanted to talk a little bit about what is telehealth. So, telehealth is a service delivery model. It includes healthcare services, information, as well as health education. People use telehealth to communicate with their providers and with their patients. So, that communication can be synchronous or asynchronous. Synchronous communication usually occurs through mediums such as video conferencing or phone calls, while asynchronous telehealth communication can include video clips, virtual technology, digital images, or anything like that. So telehealth is a really great tool to improve access to care for medically underserved populations. These populations may have difficulty accessing providers due to geographic isolation, financial constraints, as well as the inability to access transportation.
Hello, my name is Deanna, and I'm going to talk about the counter arguments to telehealth services. So the first one is the access to technology. With older adults, it is hard to use by technology, especially since of the cost, and internet connection can be unstable as well. Another counter argument is confidentiality. So due to it being at their home, there might be other family members or individuals that can hear their medical information. Also, there's a lack of in-person connection as well.
So although there are quite a few counter arguments with telehealth services, there are a lot of supports for it within Nevada as well. Like I mentioned before, it improves access to care. It also reduces the burden of care on providers in Nevada by allowing providers to treat patients within the comfort of their own homes. And it also has the ability to potentially decrease costs in Nevada by reducing potential hospital visits among older adults.
So we're going to look at a patient named Mildred. She is a 68-year-old woman who has recently had a stroke. She lives in a rural city known as Lovelock, Nevada. And due to her living in a rural city, she had a significant time to get to the hospital, which caused extreme damage to her brain. After her rehabilitation stay, she required therapy services to increase her independence since she still lives with her husband, who was recently diagnosed with Parkinson's. Since she is a caregiver and lives in a rural area, she finds it difficult to go to therapy services and even finding a therapist in her community. So not being able to go to therapy services increases her risk for having another stroke, increases her fall risk at home, and also will decline her progress of getting stronger. So this is where the Bill of Connect for Health Act comes into play.
This graph shows a number of conditions in which OT can be beneficial. And this is not an extensive list. OT covers a lot more than just what this graph shows. But occupational therapy is the only profession that helps people across the lifespan do the things that they want and need to do through the therapeutic use of daily activities. Compared to the top 10 states that use telehealth services in the United States, Nevada ranks very low. Only 1.2% of Nevadan beneficiaries are utilizing telehealth services. And one of the significant barriers is legislation. Although recent expansions have improved Medicare usage for Nevadans, supporting this bill will increase that even more by improving the access on a permanent basis to telehealth through Medicare and Medicaid.
So current legislation in Nevada is the Assembly Bill 292, which was passed in 2015, which allowed access to telehealth services. So this bill allowed clients to have access to telehealth services that would improve public health and the quality of healthcare while also lowering the cost. This also increased access to services in rural communities. Telehealth services allows the delivery of services such as assessments, monitoring, prevention, intervention, supervision, education, consultation, and counseling, which all of these services provided will help with the delivery of occupational therapy services and help patients such as Mildred. The Coronavirus Relief Bill, also which was recently passed due to COVID-19, allows access of telehealth services through Medicare. This was passed by Congress and President Trump, but we do need to remember that this is only temporary and we need a long-term solution.
So, the Connect for Health Act in 2019 was originally introduced on October 30th of last year. It really provides a unique opportunity to connect Nevadans. It allows providers to seek waivers to provide OT as well as several other therapy services through telehealth. It also enables Nevadans to receive Medicare and Medicaid coverage through telehealth on a permanent basis rather than the temporary basis that we are on currently. This act is a great way to expand healthcare coverage to Nevadans. The Centers for Medicare and Medicaid Services, or CMS, will waive coverage restrictions. This can expand services such as mental health, emergency medical services, services in rural health clinics, federally qualified health centers, as well as Indian Health Service facilities. We just want to address you specifically, Senator Masto, because we saw that you posted on Twitter that 55 years ago today, President Lyndon Johnson signed Medicare and Medicaid into law. And today, more than 135 million Americans rely on it. So we feel like this act will significantly help many Nevadans, and we hope that you will support us with this act as well.
So we wanted to take this opportunity to call you to action in support of Senator Masto. We express a sincere desire to obtain your support for the Connect for Health Act 2019. Your support and advocacy for this bill will increase access, healthcare delivery, and the overall health of thousands of your constituents, similar to the case mentioned previously. We implore you to be vocal and intentional in regard to your support of this bill now and in the months leading up to the vote. We challenge you to participate in telehealth services, including regular doctor's visits, to better understand the value of telehealth services. We intend to follow up with you within 30 days to give you the opportunity to ask questions and express your level of support for this bill and for your constituents, both in urban and rural Nevada. In conclusion, telehealth is a healthcare delivery model that improves access to health services, information, and education. Telehealth can benefit many people who suffer from an array of mental, physical, and emotional disabilities. Currently, Nevadans are not utilizing telehealth despite a large rural population. The Connect for Health Act 2019 will provide access to telehealth permanently for those on Medicare and Medicaid. We call on you, Senator Masto, to actively support and advocate for Nevadans to receive greater access to healthcare. We would also like to thank you for your time.
Thank you.
Thank you.
If you have any questions, you can ask us directly or refer to our reference section here.